Good evening. Good evening. Our meeting for the academics committee for today, October 25th, 2023, at 5 o'clock is called to order. We're meeting at the District Educational Services Center, Conference Room E. We're remote hybrid conferencing room as well. This meeting will be live streamed on the school board's YouTube channel. Requests for public comments participation will be accepted between 4 p.m. and 4:30 p.m. by sending an email with your name, phone number, and topic to Robin Cushenberry at Beaufort.k12.sc.us. You will receive a phone call during public comments where you will be able to speak and address the committee for a maximum of 3 minutes on issues within the committee's domain. The forum will be limited to 15 minutes. The mission of the Beaufort County School District, through a personalized learning approach, will prepare graduates who compete and succeed in an ever-changing global society and career market. Okay. Would you please stand for the Pledge of Allegiance? To the flag of the United States
of America,
to the
to the republic, which stands
under God,
nation under God,
liberty
and
for all.
justice for all.
You may be seated. I need an approval for today's agenda.
So moved, Madam Chair.
Thank you, Ms. Middleton. Can I get a second?
Second.
Victor, second. Was that Mr. Nay? Okay, thank you, Mr. Nay. Thank you. Vote. All in favor? All in favor? Thank you, Ms. Walker. All in favor?
Aye.
Aye.
Okay. It is approved unanimously to approve the agenda for today. We don't have any public comments. Okay, we have no public comments at this time. Period. All right. I request approval of the September 27th, 2023 committee meeting.
So moved, Madam Chair.
Thank you.
Second.
Mr. Thank you, Mr. Nay. All in favor?
Aye.
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 It is approved unanimously to approve the September 27th, 2023 committee meeting. We are going forward with our agenda for an update on Health Advisory Committee update by Dr. Stratus.
Thank you, Madam Chair, and thank you this evening, board members, for those joining us and those not joining us virtually. I'd like to take a moment prior to the update to share with our board members, those who are in the room with us this evening. We have Wendy Cartledge, our district counsel, Jillian, our paralegal for the district. I'd like to share we have an executive director joining us, Dr. Chad Cox. From Instructional Services Division, we have our director for literacy, Melissa Murray. We have Ryan Copeland, who will be sharing information on one of the items that was brought forward by board member Victor Nay. He's a new member to our team. He is our coordinator for library and library services and media services. And we have Melissa Vogt as well, a new coordinator joining us. She is our coordinator for health and physical education. From Student Services, we have Dr. Juliet White. She is our Officer for Student Services. We have Latasha Middleton, our Director for School Counselors, and Dr. Derek Skaggs, Director for Student Success. I appreciate the assistance. And who? I said, we have Executive Director, Dr. Derek Cox. So with that, I want to bring forward our opportunity for physical education and give an update on the Health Advisory Committee by Melissa Vogt at this time. Thank you.
Thank you.
Pleasure.
Good evening, Madam Chair, ladies and gentlemen. I'm Melissa Vogt, and I'm excited about filling this role as health and beauty coordinator. I started out as a physical education teacher here in Beaufort County School District, and before I transitioned to administration, I also served in this role part-time along with teaching PE. I taught at DeFusky and also helped out the person that was in this very role oversee program implementation when they put the physical education 90-minute expectation in for elementary school. So as they say, I'm going back to my roots, and it is a core value. Health and PE are vital for all of our kids, and programs are very important as well. And also, you know, skills and focusing on our practice and becoming a stronger unit together will continue to improve our processes and skills needed to promote learning for lifelong learners in health and well-being. So, but right now, we talk about meeting the students where they are. Right now, I am more into meeting the schools where they are, getting them what they need, making sure that they have the support with the state mandated resources, Aaron's Law, swimming at the elementary level, and just health instruction in general. So I've been checking in with a lot of first year teachers as well, making sure that they have what they need. So totally excited to be in this role, but now I'm going to bring you up to date on a couple of things that I found out since our last meeting, I think October 3rd, when there were some questions about protocols for the Comprehensive Health Committee. Yesterday, I spoke to Benjamin Medema, who is the state rep for health and physical education. And I just posed a question to him. What happens if we don't have the number of candidates that is required, which is 13? And we know that all those components and all those people are very important stakeholders that need to be at the table when we're reviewing policies and instruction and also just resources. We know it's important and they need to be there. However, what happens if we don't have all 13? And he said, well, that's a good question. And that has not been posed to me before. So I will get back to you. Number two, I also asked about the process of selecting the committee once we have all the candidates that have applied to be a part of this committee. How do we go about that? What does that selection process look like? Can you give us some guidelines on how we proceed? And he said, it's the committee's autonomy on how it goes. So again, nothing specific from the state level, but again, I'll follow up with him to get more information. But in your packets tonight, I did want to share, first of all, we have the bylaws that I've included in the packet, just as a reference point, but some things that I have found, I've looked in other states. I've also looked locally. I've looked in our county, at our district, looking at bylaws to see if there's any detailed information on selecting committee members. And I have just found a vague kind of selecting and appointing members. That's one of the handouts that I have included for you. It's the criteria for selecting members. And it just says demonstrating interest in youth, awareness of community, professional abilities, willingness to devote time, representation of population, and of course credibility of appointees. All valid descriptors that we need to consider, but just presenting it to all of you. Also, I included, and there are a lot of different policies when you're looking at our state, when you're looking specifically for committees, you will see that there is one example from Dorchester too. And they really do a more overall district wellness policy that does have a description in the middle of the page, on about page 3, I do believe. You will see where it says District Wellness Committee, Coordinated District Health Advisory Council. So they have a combination of things going on with policies, reviewing and creating new ones. So again, just showing what other people are doing, other places are doing to select committee members.
Madam Chair, may I hear a few items?
Yes, you may.
I'd like to bring to your attention, so if you're looking at the bylaws, we currently have received, I believe, 2 applications as well, sorry, Ms. Christian, so we have 2 applications in receipt. And as shared, it is a 13-member representation. We have not been compliant with legislation, so I'd like to maybe ask that when appropriate, that academic committee maybe chair to the policy committee, if we can have something that shares some advice, or maybe we can create some advice. If we don't have all the 13 members, do we wait for all membership, or do we start to proceed with who we have? And I think that's an important conversation possibly to have with our leads in policy committee, because there's no language related to that within this policy and within the bylaws. Ms. Lynn Cartlett?
Yeah, I was going to say that I've spoken with some of the in-house attorneys that work in other districts, and they said that what they have done, they've gone,
so they can hear you.
they've gone out into, they have gone into the community to try to find people that were interested. So for example, we need 3 clergy members.
So did they wait to have full membership?
What they did, they got all their
Yeah.
members,
Yeah.
but they would make sure that different faiths were represented. So that we wanted to have a variety, so we ensure that we have everybody represented. 2 teachers, 2 students, one of them has to be president of the student body. There is actually somebody that's interest from Beaufort High, president of the student body. But for us to go to try to find people that are interested in the health of children so that they can serve in this capacity. So if we can, all of us, and for the board members, you all can recommend. You can recommend and
Yeah,
talk
let's
to
ask
people
for-
that, because it says right in here, for the board members recommend, and you all know people.
It does represent from
Yeah, right here, any member of the board, former current members of the HAC and members of the community can make nomination. Good evening. For the committee. We just need to get a look at something else. And we go.
Yes, so we do have this published on the community area on our website. Is there interest? It was
I
under-
just hear temporary. Oh, no, you're board member.
It was under, it was under our parents, and it's now been published under community to get it more into the foresight. So. Is it, Ms. Cartley? So would that be maybe a recommendation for either an update in the bylaws to state that full membership prior to establishing a meeting?
Well, I think that right now it says she'll be appointed by the board and consists of 13 members. And that's who's represented, so we need to be getting people
Okay,
to
so,
come, we need to be recruiting.
so the other item just for consideration, I did come up with the board member was the selection criteria. So I just want us to recognize that at this time, this is the most we could find. And I did recommend to the board that we don't want to go ahead and be out on our own, but this was found from research from his vote in detail. So it does give a profile of what to look for. So what we can do for those who have applied, may I recommend that we bring those resumes forward for our next academic meeting. We could possibly get a letter of support from legal to say, hey, we're putting our committees together, and we can make a decision as how these are the next meeting for those who haven't applied, so they can get some type of feedback. Would that be something for consideration?
Ms. Middleton, Mr. Nay, do you have any questions or any comments? about how this-
No
Okay.
questions, but I do agree with what Dr. Strato said and bringing that information back to us. I think we should look over it and then make a decision.
Okay.
Thank you, Mr. Nay.
Yes, first of all, I don't think that we're going to be able to fill this committee on a passive manner. I think we're going to have to be active. I think we're going to have to go out and actively try to find people that want to be involved. Like have kneecap to kneecap conversations with community members and try to get them on board with this. As far as the teachers go, does this all have to be volunteer, or can we assign teachers to this? It says one of them has to be a school board. A president of their committee, whatever, high school committee, government. Can we assign, say, okay, if you're a president of the student body for May River High School, you're it, or Bluffton High School this year, or Whale Branch High School next year, or something like that. It just, along with being student body president, you are assigned to this committee. Or if you're the director of health services, you're assigned to this committee, or whatever it is, and make mandatory assignments for this so that we can at least flush out some of the committee. And then we try to maybe use a little passive, if not active, engagement to try to get more people on the board.
Madam Chair, may I?
Yes.
So, Ms. Dene, I love the idea of rotating the membership of student government. So I could work with, actually, Dr. Potts is in the room, maybe we could work to set up a cycle. That's a great idea, so because student government generally, they would do community and service hours. So it also helps on their resume as well. So we could maybe do a rotation design, and we could work that out, ma'am. Looking at the teachers, my only question of that is to be cautious on the contract of service. It should be a volunteer instead of in lieu of requiring membership. So I believe we have at least one application of an educator. We have one certified educator right now. We have one community member. Those are the two applications we have at this time. We could work to solicit support of personnel coming out, as well as I'm going to ask for everyone else to please assist with this as well. Okay, thank you.
Dr. Cox, may I ask you a question?
Yes, ma'am.
Based on what Dr. Strata said. I know we shouldn't and can't assign a teacher and say, hey, you got to do this and you got to be on that committee. Okay, but how would we go about getting teachers unless we do like the rotation that Mr. Nay suggested, that Beaufort has a teacher 1 year and St. Helena, whatever, so that we can meet our requirements.
I think Johnny said there was.
We have a solution. If I may,
Go ahead.
yeah, Vogue has her teaching certificate and she is in the health field.
Well, but also know that this vote is over the PE, what is it?
Health and finance.
So would that be a double for her? To be on this?
She would be involved if we could share. So one of the ideas that she would like to do is and we have to determine this as well, is we on current material. It's going to be utilized as well. It hasn't gone through the advisory board. So she would be at the meetings anyway. So would it be possible if she applied? I'm just putting that out there, but she would be putting the time in. Yeah, she would be.
And if there are certified teachers that still want to step up, that's great too.
Yeah, and then she would just step, but at least that would be 3 for right now, and then we can get some assistance with clergy and medical practitioners in the field. And was that a student government president you spoke with?
I spoke with the principal who recommended. Her school body president said that something that person be interested to, or chair's gonna follow up. So
Yeah, I mean, we could, I do believe that if we approach the teachers in a way that they see the value of involvement, that we will have teachers. So for example, some of them have been participating and you see the partnership with DEC in Charleston that they've done, and many schools got involved with it. So I think especially through that avenue, that would be willing to do so. And I know the students will be willing to do so. And it's good practice for them.
Thank you.
Ms. Middleton.
I have a question. Can we ask the teacher of the year to do it, to serve for the district?
That's an excellent recommendation.
Because then each year, the teacher, we could add that to the teacher of the year responsibilities, and we will have somebody in that role as a teacher every year.
I could speak to HR.
Okay.
Yes.
HR.
Yes. And are we looking at just that 1 year that teacher would be? Because we get a new teacher of the year every year.
Yeah. No, it all depends on how
Because we're all-
you want to work it out.
Well, we're saying we need 2 teachers, so that's 1.
Yes.
That a bylaw identifies a 3-year term.
Right. It's a 3-year
It is on page 2, Roman numeral 4. That would be the most complication.
Right with you.
So can we do this? Can we have the teacher of the year, like for this first round, we'll have the teacher of the year that would be there for 3 years. And then that person would stay on. And then we'll have the next year's teacher of the year on. So you have a steady rotation, but you'll have your 2 teachers on at all times.
Good suggestion. Okay. Mr. Dallas.
Thank you, Madam Chair. I think this is a wonderful way of moving forward and involving the community, as Mr. Ney mentioned, being a little bit more active in outreach. We've been making presentations on the referendum, and one of the recurring questions is people ask, how can they get involved? So I think there's a latent group of residents and voters who, if they know of this opportunity, would be very interested. And so I think that's really a way to go. Dr. Cox's point about the teachers being interested, I actually received a letter from a teacher which triggered my awareness of the existence of a health advisory committee. So I think they too are out there and want to participate. So I'm glad to support this effort, however you want to move it forward. Thank you, ma'am.
Thank you. Mr. Willie. Mr. Smith.
Yes, I was going to say something along the lines of Mr. Dawson said. I truly think that it's not going to be harder than what we anticipate for teachers to apply. I believe that teachers are going to apply for this. And my thing is I'm looking for consistency, because I remember we first talked about the 3-year term. So I'm looking for it. I would be concerned for consistency and understanding the process of this. To teach a different person coming in every year, having to learn, and they're working on something, then now they have to be brought up to speed versus every year versus every 3 years. So I'm looking for someone who will be looking forward to come on for 3 years and make that sacrifice and say, hey, I'm on board. So, but I really honestly don't think that would happen. And that's the first thing. The second thing is, I would not really want to tell someone that this is what I think this is a position that you have to have a passion for, and we really want somebody who want to be there and not doing something because they're serving teacher of the year or one of those different offices. I think that this is something that you have to be drawn to, because it sounds like it's going to be some work into this. So I'm not really forward to pushing someone in terms of those students. We have students that go to the state every year at State House, and being Beaufort County students. They have been leading as a program where you become state senators or you say legislators for there. So we have a lot of students I know from Beaufort High School for the past couple of years have been leading that. I'm sure they will be willing to jump into this head first. So I think we should see if we can get a good volunteer pool before we start assigning people in. I don't want to put the horse before the cart. I just think that everyone, your energy is good. I think that we can possibly get some people here who are sound and who are really into it. Thank you.
Thank you. All right, so Dr. Stratus, if correct me or add if I'm just to recap this, we're gonna go forward with what we have. To include getting this membership started with Dr. Muller. Thank you, Melissa. She'll be with us, looking at Teacher of the Year. You can check with HR to make sure this is something that that we can do. We're also going to be looking at getting people from the community and teachers and making sure they understand that it is a 3-year commitment, right? Even for the 2 students, but it depends if it's just 1 student. Okay. One big, well, no, it's 2 students, one being the president of the student body.
And they serve 1 annual.
And they serve 1 annually. So, and 2 health professionals, so we need to get on that. I think when Mr. Smith, what you're in the mandatory assignments, we're saying we're not making it mandatory, but we're going to check to see if that is a responsibility that the Teacher of the Year can fulfill while he or she is our Teacher of the Year. And I think right now we have like 3, right? Secondary, elementary, so we have 3. And high school, one of them. Yes.
So if you all decide about having the Teacher of the Year serve for 1-year term, you change your bylaws. But right now it's a 3-year term for the health professionals, clergy, the team members and teachers. Only the students are 1-year term.
Okay, so did you hear that? The students are 1-year terms for the teachers and the others are 3-year terms. And if we go forth with the Teacher of the Year, because they're only Teacher of the Year 1 year, we may have to change our bylaws to reflect that, which I think is smart to do. And they may stay on, who knows, to do that once we get it cleared with HR that is something that we can do. Yes, Mrs.
My question is also, didn't we have a doctor that deal with the district? I thought we had a doctor.
Oh, yes, sir. So, board members, we do have an agreement with Beaufort Hospital. We have a medical consultant, Dr. Bechtel. He is a board certified primary care physician, and he assists us with our protocols and policies for our nursing, delivery of care, administration, medications. We've been working with him with respect to the Narcan. So he is we work with him here in the community. He's not a volunteer, but we pay him just per diem. I'm saying PR.
Well, it's actually that we had, and I just didn't hear anything about it through the process, and I was just wondering if he might have fallen somewhere, or if he was or if he was involved or engaged in this operation at all.
No, but if he wanted to apply, then he was not volunteering.
Gotcha.
Okay.
Okay.
That's a good idea.
So just to pick up on the summary as well, Madam Chair. So if we could work amongst our board and membership committee and membership within those here to recruit. We'll look at additional recruitment efforts. It's evident that you have had conversation, not the consensus had if they could submit their names with help.
Yes.
Right.
We have a retired surgeon that's present in here. So
Thank you. And then we may have, I don't want to assume on that one teacher we shared it, they do have experience significant meaning. And I think you apply yourself. Then we do need to work with support for the parents and the clergy, some recommendations and health professionals. We may be able to cover the 2 teachers and the student. Okay. And right now we have 1 community member who has expressed interest. If someone knows of another community member that you'd like to recommend, All right, so that would be greatly appreciated. Yes,
Thank
thank you.
Mr. Nate, thank you for being patient.
Thank you, Madam Chair. As far as the health professionals, it seems pretty ambiguous. Are we talking about doctors? Are we talking about dentists? Are we talking about administrators that work in the healthcare profession? Is there any defining guidance on that?
So the health professionals would be individuals who are employed in the profession such as doctors, nurses, physical therapists, dietitians, pharmacists, physical therapists, individuals who are involved in healthcare actively. Dentists too, you're right, Mr. Nay.
Did you hear that, Mr. Nay?
Yes, I did. Thank you for clarifying. Appreciate you.
Yes, sir, thank you.
All right. So any more discussions about this particular piece? Are we clear about what we're going to do?
Yes,
moving
ma'am.
forward? I'll be talking about the Stratus as well to see where we are. This is a big undertaking. And I'm really glad, Melissa, that you, sorry, I know you got lost. For stepping up. I appreciate that. I appreciate it. That's critical. Any more questions or discussion on the bylaws of the Beaufort County School District Health Advisory Committee and what that is going to look like? And my understanding is that we're going to meet again and have this a little bit more fine-tuned.
We'll bring forward what we have for review on the
Yes.
resumes.
Yes.
And in between now and I believe we'll set the date at the end of this meeting. If I can encourage individuals to get others to submit their letter of interest or their resume would greatly help.
Okay.
Okay, thank you.
Thank you. All right, we're going to go to our next topic item. You ready? Okay.
Yes, ma'am.
All right, thank you. The discussion on interlibrary district initiative.
Thank you, Madam Chair. It is a great pleasure to bring forward Ryan Copeland, our new coordinator for library services for Beaufort County School District. He has prepared some information with regard to research that he's conducted. He has additional talking points, so I do want to turn the floor over to Mr. Copeland. So thank you.
Thank you, Dr. Strauss, and thank you, Madam Chair and other board members present, allowing me to present. Just wanted to take a minute and I am Ryan Copeland. I'm District Library Coordinator for roughly 2 weeks. Thank you, but I spent the past 8 years at Battery Creek High School as the school librarian. I will start off by telling you a little bit about how the current internal process works in terms of getting a book. If a student in a school comes up to a school librarian or library assistant with a request for a book, the first thing that would happen would be that book title or author would be looked up in the catalog, the school catalog. Ideally, we would have that book in that school catalog, and it would be checked out to that student. Found on the shelf, checked out, assuming there's no opt-out form. The other things that can happen if that book is not in the catalog at that specific school is we would check other schools in the district. So seeing if another school would have that particular title. If that is the case, there is an interlibrary loan. We can borrow it from another school. If it is not in the catalog at another school, that's roughly the end of the transaction. So potential advantages of working with the Beaufort County Public Library System, it would deepen an existing supportive relationship we have with them. We already work with them on summer reading programs. There have been studies that have shown that while still in school, students who can forge a meaningful connection with a public library means they're more likely to utilize the public library services as an adult. It's creating an awareness for them. And on a case-by-case basis, interlibrary loan requests can be a cost-effective way to meet the needs of a particular patron. Researching a specific niche subject, something that would not be in a normal school catalog. Where we are right now, there is no formal interlibrary loan agreement between Beaufort County School District and Beaufort County Public Library. So should a student in one of our schools express a desire to borrow material from the public library, what we can do is encourage them to sign up for a public library card. We could even go as far as showing them online how to find the county public library catalog. Current library card holders, if a student is a current patron of the county system, they can place the item on hold at a local branch, but they are responsible for pickup and return of the material. So some considerations to an interlibrary loan. First that we have is privacy. Beaufort County Public Library does not have access to our student patron notes in Destiny, which is our catalog system. They would not know what our students have in terms of books they've checked out, fines that they would have, any kind of notes, opt-out forms, things of that nature. Conversely, the county staff, county library would not, they would not have that. School staff would also not have access to the public library records. So we would not know what our students have in the public system. So that sort of limits the capacity that we have as school librarians to assist students. Brings up multiple issues of student confidentiality as well, if we're sharing with the public library. Organization affiliation and state guidance. South Carolina Department of Education recently severed ties with the South Carolina Association of School Librarians. Direct oversight is and has always been solely the South Carolina Department of Education. And with the public library, responsibility for oversight for them is a combination of a public advisory board and Beaufort County Council. Individual librarians in both the school system and the public system have affiliations with several organizations such as South Carolina Association of School Librarians or the American Library Association. None of those are institutional in nature. So those are just individual memberships. And then management of assets. This is where it can get a little tricky. The school district and the public library systems have separate cataloging systems. Those systems do not talk to each other. Completely separate information and organization of that information. So a school student, BCSD library patron would need a public card, as mentioned before any transaction with the public library could be fulfilled. And requirements for a card are relatively lengthy for a student. They would first complete an online form. They would then have to have a parent or guardian fill out part of that on behalf of them if they're under 18. And then the physical library card must be picked up at the local library branch before they can check out any kind of book there. There's a completion of proof of residency, some other forms for under 18. There's also currently no courier service. So physically, how do students in the school system borrow a book from the public library and get it to them? Who is responsible? Any plans associated with that could be costly. That sort of lets you know where we are right now with the possible relationship between school district and county.
You asked a question. What was the reason why the state Department of Education several times with the South Carolina School, American School Library. What was the reason? When they didn't do anything. I can't remember.
I can answer that a little bit, and then I'll turn it over to Dr. Stratus, because she was. She was kind enough. The short version is our state superintendent disagreed with the Librarian Association. At first, it appeared that she was on board with them about the banning of the books. And then she did kind of sort of an about face and decided that she didn't want to have anything else to do with their organization because of the banning of the books. So that's where we are. They're going forward with what they do with the Library Association, but they are kind of perplexed that in midstream that she would first say, yes, you guys are doing a great job. We're doing well with this, and then turn around and say, I'm not gonna have any part of this. And she pulled out. Now, I didn't think that she could just pull out, but that's me.
But it's a separate association.
That's true.
Right, and they weren't tied to the Department of Education. It is more of an organization if you subscribe to. I believe there was a large amount of pressure or influence, but I can't speak for Superintendent Weaver. But as a follow-up to a reference of a few articles, and it'll be a follow-up conversation here that I believe you as board members want to speak about, is the state is seeking to also design a model by which they identify the books that could be utilized at schools. Because that would be part from classrooms as well as within our libraries. I did some follow-up on yesterday for whom I could reach out to, who has some ear to the wall. That those conversations are happening, but they're also recognizing there's a fiscal amount that's tied to that, Mr. Campbell. So if I say to you, you may only have these, then districts are going to push back and say, how is this being funded? And that hasn't been clarified yet either. So I think this influence that's happening, I mean, we live it, we walk it. And it is also tied to the Transparency Act and other items that are happening in states.
Are there any questions, members? Ms. Middleton, Mr. Nay? There is an article.
I do have some comments.
Go ahead.
Thank you, Madam Chair. All these challenges that were mentioned, I believe, are just challenges. I don't think that any of these are insurmountable. Yes, okay, we got some things to figure out, but I definitely think that we can establish a relationship with our sorry, my dog is freaking out. With our county school board, or I'm sorry, with our county libraries. But and as far as maybe like I don't where all this started was we actually had comments last school year to the board from our community members saying that they could not afford to take time or afford to go to the public library. So that's why they wanted all these as many books as possible left on the shelves. Or some of these books on the shelves because they didn't have time or couldn't afford to go to the public library. So that's where all this started from. So how do we get past that hurdle? As far as a courier service, does not the county library have their own courier service between libraries? How do they deliver books if there's one library? Or, how would we, the same way that we would do it, right? If there was a library or a book at one library but not at the other, somebody would go get that book to bring it back for our student, correct? So I believe they have the same courier system. Why couldn't they just stop at one of our high schools if they needed to drop off a book or pick one up? I don't think it's insurmountable. Have we spoken to anybody from the Beaufort County or the Beaufort County library system about starting a relationship yet?
Actually, Mr. Nay, the team has had conversation when we haven't gone to the level of fiscal responsibility as to who would be incurring the additional costs. There's also the issue of we haven't gone to legal regarding student information as well. So there's a few items, and I have to share another item that came up in breaking down from the fiscal list, the student list, right? The information types of a parent, my mom doesn't want me to read certain material. We have to then also note that the library system is now following what the school systems put into place. So there's a few other items in place that we have to go further and deeper conversation. And at surface, we haven't gotten to there yet, even to bring that to the table, because there's maybe right now a little difference in philosophical practice.
Thank you. Mr. Carlton's hand is up. Do you have a question, Mr. Nay, about what was just said to you?
No, not a question. But yeah, I'm looking forward to going down this rabbit hole. I don't think this is insurmountable. I think, yes, it's going to take time and maybe a slow ship to turn, but it's not insurmountable.
Right, and if we realize that this is a big onion that we're feeling, I have to share that. So thank you.
Thank you. Thank you both. Mr. Carlton.
Yes, ma'am. Thank you, Madam Chair. I'm quite fascinated by this. I think an announcement that there's a partnership between the BCSD and the BCPL would be energizing to both institutions. Having my wife was on the Friends of the Library board, and I know that one of the things that's really important is how do they grow their membership and participation where their key demographic is declining in numbers, the older age population, such as myself. And so I think this could, as was said earlier, could expose young kids to actually going to the library. That would be beneficial to both institutions. The two issues of privacy, I think, is critically important because the school district is held to such high standards. So we want to be very cautious there. In terms of transportation, Mr. Nay is right. The public libraries do have their transportation. They have some buses. I don't know what format or what type of vehicle they use to transport books and materials, but I think it's worth posing that question to them. Thank you.
Thank you. Ms. Middleton, are you good? Do you have anything else to comment on?
No, ma'am.
Mr. Campbell?
Never mind, I won't.
You sure?
Yeah, I'm not saying, yeah.
Mrs. Smith, you sure?
Yeah, it's political.
Yeah.
And I don't want to get involved.
Mrs. Smith?
I definitely agree with what Mr. Campbell said. It's political, but to the degree of the importance of serving our students. I too personally have worked with the director of the library, remember when she first got here? And they also have their own board. So I too know how tedious that this will be. And I wish I wish you luck with it. But I'm looking forward to seeing the results coming out of that rabbit hole. But I know that y'all won't let our students down because we do support our students here and that we will get it done. And I think that mostly protecting our students' personal information is very important. And I do hear that coming out of race, so that's something good that you know that the staff is on the right track. And I just look forward to where we can work together and get things done for fall students in Beaufort County. That's what I got for you.
Thank you. And I will say, I too am interested in how this is going to, pan out in our community. But the transportation piece really disturbs me because that is not equitable across Beaufort County to get these items, the kids to the libraries, and also the fact that social media has just really put a hurt on local libraries. They're not growing. But I do think that there are options if parents can't find the book, that they can also order it, Amazon, you name it. So there are other options out there, and I don't think that Beaufort County is trying not to serve these children. Our libraries are full of wonderful books and painstakingly so. I think there's the fiscal part of financing I think it's the other part of getting collaboration with the public libraries. I don't want to see where we're footing most of the bill for this. And I don't want children denied because we're gonna say, hey, we're gonna open up this can of worms and have the library and Beaufort County work together. And they go to one of the libraries and the book's not there either. So there are a lot of concerns here. It's worth talking about. I appreciate the talk. And I look forward to what we decide to do as a committee.
May I pose a question for
Mhm.
research purpose? So as a student, I have a library card, I can go into electronic catalog and reserve a book. And that would not have cost if I can get the book at the library.
At a library, right. But he also said if the book is not there, that's it. Right? There's nothing else you can do
In the school library.
in the school library. Okay.
Correct. And or in the school library catalog at another school.
But then if they go to the local library who we have partnership with, they don't have the book, what happens? I'm just saying there are a lot of
Right.
parameters here. We have to make sure that we do not promise something that we cannot fulfill. And as you say, consistency.
Yes, ma'am. But also, Madam Chair, just to your point of view, mine, also, well, just FYI, or really FYI, they do have a bookmobile.
Yes.
And the bookmobile go out in the summertime, so it really shouldn't be a problem transporting those books back and forth or to school, to kids, or to a building to drop off. I just wanted to your point, there is a bookmobile, so I don't see where it should be a cost driving on one person, and particularly if the bookmobile is going to run year round. I mean, maybe then that cost even comes from county council because we are all serving kids in Beaufort County and community, everyone.
There is a cost. You have to pay the driver, you got to pay the gas, the maintenance of the vehicle, you got to get the books. So there is a cost.
Right, I agree with that, but I'm just saying that they're already doing it, then they can incur that cost. That's all.
All right, members, any questions from anyone else before we move on to the next agenda item? Thank you. This has been a great discussion. Moving along, so did we also already hit the discussion on the South Carolina Department of Education seeking
Yes,
control?
ma'am, I-
So we can go on?
Yes, ma'am.
Okay.
Thank
School
you.
counselors update. I know y'all ready to go. Yeah, thank you for your patience. Thank you for coming. Mr. Smith has been waiting for this report since 1901. So we're gonna move on.
Is that what I sent you?
Yes.
Yeah, that's what you sent me.
No, that's me. Thank you.
That is not it.
Oh, okay.
She was right here. She said powerful.
That's not it.
It's the.
You know what?
Yeah,
I see that.
Yeah.
Well, this is the PowerPoint. Okay. Hold on. Here you go.
Thank you.
All right, good evening. Madam Chair and board members.
Can you email me the
I don't, but I can email it to you.
Yeah, because I need to put it up.
Okay.
I can't put it up there with that. Unless you want to move on to something else, because if I don't have it, I can't put it up.
We can go ahead too. Oh, you know, it's good.
Go ahead. We'll do this.
Okay.
Madam Chair, we're gonna flip the agenda with your approval. So as they pull up this presentation electronically, you're gonna receive the with OE 13.
So we don't have the
We're gonna be getting.
No, we don't have that. We're gonna make the copies
Okay.
and she's gonna email it to me.
Yeah.
Because I got,
Are you good with moving to the next?
I
agenda?
am filtering on.
Thank you, ma'am.
So what do we have next? We have the OE 13. Discipline.
Yes,
Thank you.
so
Thank you.
good evening, Madam Chair and board members. Today we're gonna go over and just highlight OE 13 for discipline. you did have the executive summary report. I just kind of pulled a couple things out in a presentation. Joining me with that presentation is Dr. Derek Skaggs, Director of Students for the Best, and Dr. Chad Cox, Executive Director, who we collaborate a lot around some of the procedures and different things we're doing in schools, so we can make sure that we have that consistency across most schools. So we had to report pretty much on when it comes to discipline and what the superintendent's expectations are, really is making sure that we have some sound systems in place. And that we involve all stakeholders in what we do as far as discipline practices across the district. So keep in mind that the purpose of our of the discipline is really to have that holistic approach to making sure that our kids behave and that they stay in school, so we can overachieve our district's overarching goal of high student achievement as well. What we saw in, we'll explain that as we go through the presentation, is that we have some significant transformations happening in how we approach the discipline in past academic years. And you'll see those changes as we review the data from 2021 to 2023, as well as the proactive measures that we are taking to deal with discipline. One of the biggest things for schools and parents that we communicate to them is the use of our progressive discipline plans for the code of conduct that is published on our district's website and shared and updated as needed annually. And those updates usually take place with feedback from schools as well. Know that everything that we do around discipline is governed by state law, federal law, or administrative regulations. So for example, when it comes to discipline of students with disabilities, a lot of how we have to deal with that is governed by IDEA, Individuals with Disability Education Act. When we talk about, there's a law, a state law that talks about kids cannot be removed from school for more than 30 days. So it's really important and prudent that we monitor that data to make sure that we're following those laws. And then taking those laws, we develop our administrative regulations that govern how we behave and how we practice as a system as well. So the big purpose of that plan is really to communicate the expectations in terms of timely attendance, respect for people and property, appropriate dress, technology use, and a lot of the codes and the infractions that we see in the progressive discipline plan is what is given to us by the state and the different levels, misconduct, behavior, criminal conduct. We don't decide what that looks like. We use the state regulations as governed to develop what that looks like in the district. So when we talk about making sure that we update those laws, as legislation or updates happen in the law, sometimes we're forced to make the updates too, so we can be in real time and compliant. So this past year, one of the things we did get in feedback is making sure that we went back through our progressive discipline plan. Didn't have a lot of major sweeping changes to deal with it, but we tried to use a very holistic and committee. If you remember about 5 years ago, when we first developed this, there were 50 people we served. So we kind of adopted that method, a combination of in-person meetings, Zoom, and using Google Docs and all of that to make sure. So we divided the committee into 4 subcommittees, and they were all assigned around a designated discipline matrix. So if you look at our progressive discipline matrix, you see we have early childhood, elementary school, middle, and high school. So we had subcommittees, and just about all of us in this room from the school system were a part of these committees. Outside of that committee, we also have a research or facilitator committee to support their work. So as they're making their work, they came back to a group of us to make sure that they're aligned with the state laws. Like I said, everything we had pretty much was intact. And that work was really led by Dr. Skaggs. He led the work for the updates because he's the one that works most closely with schools, administrators, and teachers around the implementation of our discipline practices as well. And so I am going to turn this portion over to him now to talk about what was one of the major, not really major changes, but made it easier to follow.
There's a couple major changes, of course. The committees were formed based on professionals in their area. So pre-K,
through second was early childhood folks led by Ashley Hutchinson. Our elementary, which is grades 3 through 5 matrix, was led by Dr. Levan. So that's Levan, who's one of our executive directors, and the team of principals, teachers, paraprofessionals. They reached out for input from a lot of folks as well. Middle school matrix was led by Melissa Dixon. Excuse me. And then high school was led by Dr. Cox. And then the committees were formed with folks that were in those types of schools. So they were professionals there. So we did make a couple significant changes, nothing too overwhelming. So some of the things that we tightened up on was anything that had to do with violence, drugs, threats, weapons, those type of things we tightened up on. So if you go in level 3 or whatever, we really just say, hey, we're drawing our line here. But one of the things that the committees came back with that I really love and that the state's pushing and that we're really pushing as far as being a trauma-informed district is really some of the more some of the level 1, level 2 type behaviors that are more your kind of classroom disruptions. We want it to be intervention focused. So if you look here at this first page here, these are classroom managed behaviors. We want to put the power back in the hands of the teachers and also give them some strategies of how to kind of intervene or be proactive on some of the behaviors that they were seeing constantly, some of the chronic behaviors that we were seeing across the district. So the first page of every matrix, whether it be early childhood, elementary, middle school, or high school, it really separates that classroom managed behaviors from that office managed behaviors or administrator managed behaviors to really try to arm that teacher with some strategies on how they can help students in their classroom who are just having some kind of more minor behaviors, right? So we put those in there. If you look there, the first page, it really does kind of direct them and kind of give them suggestions on how to deal with some of those behaviors that we're seeing. That was kind of the biggest change there, is making sure that we really did start providing some teaching around behaviors. Historically, school districts and we haven't done a great job historically of teaching behaviors of what we expect. So now that's something that we provide guidance on, something we provide lessons on, and something that we actually put into the matrix that we are going to teach these skills. We're not going to tolerate these behaviors though when it comes to more of the aggressive stuff. So one of the big pushes we've been making since especially getting back from COVID, that was a whole crisis on its own, especially when it comes to skill development, social skills, any type of behavioral skills. A lot of kids kind of missed out on years of that, right? So one of the big pushes that we've been making is multi-tiered systems of supports, especially around behavior. And that being said, is we're really trying to teach what we expect, kind of like what I said earlier. When it comes to certain behaviors, we're trying to teach the skills, how to cope, how to self-regulate, things like that. And then we're also pushing those systems within the school and coming up with assessments and ways to support the schools in developing those systems of support for kids. In other words, we're trying something a little bit different, right? So what you're looking at right there is our tier 1 hikes that we push out to the school. Tier 1 is for all kids every day, right? These are our common expectations around the school. These are how we're looking at discipline data and making decisions as far as how to be more proactive in certain locations or certain classrooms. This is our development of our lesson plans around our expectations. What we expect. We're going to teach those continuously and consistently throughout the school year. And these are the expectations district-wide now for all of our schools. We're developing systems that reinforce behavior. We know that behavior is driven by reinforcement. I mean, most people go to work. Why? They want a paycheck. Not that we're trying to bribe kids or anything like that, but we're setting the expectations. And when we see you meet expectations, you're going to get a little pat on the back or a good job. And we're going to let you know that you're doing a good job meeting those expectations, right? But we're also gonna put systems in place to discourage behavior, which is why when you see the matrix, you see that there's a lot of discouragement in that matrix as far as if you cross this line, this is not what you're supposed to do. We're going to get you some additional help. All right. So that's, and then also we're getting to our classrooms. The last one there, number 8, we're getting to our classrooms there, and we're actually teaching our teachers better classroom management because it all starts in the classroom. It all starts in the classroom. So not only are we arming them with more strategies within the classroom, we're actually giving them kind of a framework to go by as far as here's what good classroom management looks like. Here's what good routines and procedures look like. so we can have, more safe and orderly classrooms. So, we do monitor discipline behavior. It is important to note that, since before COVID, actually our numbers have come down from pre-COVID to now. But the COVID year 1920 of the shutdowns, of course, our numbers were pretty low there. 2021 we had a late start in the virtual. So if you were to do that longitudinal data look, it does look like 2021 had much less numbers, but you got to keep in mind of how many less days of school we were actually in as well. And then also when you look at 21, 22, we were still doing not forced quarantines, but mandated quarantines, for COVID, whatnot. So last year and this year are really are good, like getting back on track with all of our kids back in school, hopefully, the pandemic's over. And so we're starting to get more of those good data numbers in. So we're tracking the behavior data, but we're also tracking the plan data. So whenever a student's having chronic issues, for example, being self-regulating classroom, right? And we start providing supports, we write what's called intervention plans, right? MTSS behavioral plans. And we've been tracking those numbers since I've been back. And since the first year that I got here, we were much lower. And then 2021, we got up to 285 support plans, which is pretty good. And then last year, we got up to 390, so a good increase there. And then this year, we're actually way ahead of that. So we've been putting more of a focus on intervention and support when it comes to, like I said, some of the less violent, some of the non-drug offenses. We're putting more emphasis on that. But when it comes to some of the other things, we're actually tightening down on those and trying to get them more intensive support in sometimes different locations. So that was kind of it in a nutshell. I did want to report though, as of Q1 this year, we're down 10% from last year. As far as overall discipline.
So as we go through the discipline, we have the plan. We, as Dr. Sky mentioned, we are doing a really good job. Started last year, really monitoring the discipline data, really looking at it from the lens of the principal and not Skaggs, and Dr. Cox works with because he supports mostly middle and high school. Have data conversations around behavior, because a lot of times you were doing it basically around academics and not as well as around behavior. So we're doing that, and I do need to mention that when we go out to do professional development, sometimes we don't always go in isolation as behavior, because we have to show schools how holistically talk about all the kids, talk about the academic performance. So if they're seeing some weaknesses in academics, is it a result of the behavior that's keeping them out of school? And then we look at the other student services areas. Is it because of absences? Is it, because of some mental health issues? So we're turning it to use more of what we call a student services model. As well, you'll see some of that in the report from the guidance counselor and how we're collaborating as a group. So we're really targeting support to individual schools. We're now going to tier them as well. We do that with students. So why we have some schools that need us to come in and support them, both in administrative level and the teacher level as well. And we have some schools might not need us all the time, but we're keeping an eye on those to make sure that they're not spikes. And we're doing quarterly data, and we're starting to do a better job this year in our academic cabinet meetings of bringing forth that data on a more consistent basis than what we've done before. There are also professional learning opportunities that we're doing around, guys mentioned some trauma informed kinds of things, but wanted to put a focus on how to use the data, how to interpret the data, and then use that data to make the shifts within the schools to develop good plans for all of the students. So it's really constantly doing a professional development, not waiting to just professional development day or those few that we have assigned, but we're going into schools as a team and working with administrative teams. We have been, we work consistently on a monthly basis with our behavior management specialists and our behavior interventionists as well, and making sure that we're improving their skill set to continue to support schools. And this year, both Dr. Skaggs and Ms. Graham, who is the administrator for student success, they have a plan moving forward. So that's one of the things we're doing as a result of this data from last year. We're going to go to support schools more on a consistent basis. So this is just a breakdown of the data a little bit more, and this is where Dr. Skies and Dr. Potts will jump in and share. And what I wanted to show you, this is coming from Educator's Handbook, which is a dashboard that all of our administrators have access to see their discipline data in real time as well. And we monitor from our level to make sure too that codings and things are going in correctly. And so we just brought out a comparison of some key things that as soon as you log into the dashboard, they can see, and you can do that. No, it's kind of tiny to read on the screen, but Dr. Skaggs and
Yeah, so essentially, this is a function that we have a referral management system. And then, so the state has a database that we use, PowerSchool. This database will communicate with PowerSchool. But as far as entering referrals, entering all of those different discipline actions that are in there, the school level administrators are able to look at this in real time. But as an executive director, I'm able to monitor their data in real time as well. So I can pull them by school, by a group of schools, by the high schools, a variety of ways. But one of the reasons we wanted to reflect this is the kind of thing that they see when they go in to look at their discipline. So sometimes I go in with them and work with them on a variety of things. And there are things that you wouldn't necessarily think of when it comes to discipline. For example, you would likely see a rise in discipline between, say, 11 and 1. Why would that be? Right? Right. Or if you're beginning to see, or you see there's other things in there, you may see certain locations that you need to shift supervision for. There may be certain grade levels that you need to focus on. And sometimes it is helpful to present this data to teachers. Sometimes the actions of reviews seem like they're the norm until you look at it in form of a data point. And when you actually see the data, it begins to show you that, you know, the majority are doing the right thing. So, and for example, one of the data points that I would want you to see is the percentage of students with referrals. So 70% of you can say it one or two ways, 30%, that's one referral. Okay. If we go to the percentage of students that have one referral or less, that number jumps to like 85% of our students have one referral or less. But we wanted to be as transparent as possible. What's that? 70% have no referrals. Right. And 85% have one referral or less. But so we wanted to show you that as well. And then also by level, you'll see the level percentages that break down. Again, we don't determine those levels. Those levels are determined. I do want to say something when it says criminal conduct. Not all infractions are criminal. So that language is not determined by us. That language is determined by the state. And I think one of the best ways to define it, if it's in that category, it could have the potential to end up with involvement with law enforcement. That doesn't mean they all become that. That's just the way that the state views it. For example, in level 2, some of those infractions that are listed in there, you or I may not consider disruptive to the school. It might be disruptive to that child, but not necessarily to a class or to the school. Also, when you're looking at grade levels, the top 3 grades, you're always going to see 9th as the top, because as students progress in high school, that is pulled by their not necessarily what we call 9GR, the year they actually are. So if you're an overage student and you're still classified as 9th grade, you're lumped into that data. So I don't know if that helps them. That's what they look at, and that's the kind of thing we work with the principals on to examine this.
Thank you. So with all that, where do we go, right? We're always on a continuous improvement journey. We're always striving to improve our processes. And I talked about some of those things that we were focusing on going into this school year. But really trying to make sure that we foster that environment where discipline and the student support is going hand in hand. We're trying not to be as disjointed. And we really keeping our pulse on that and really still having that emphasis on early intervention, those multi-tiered systems of supports, and really having a constructive approach to this as well. So our commitment is going to stand steadfast. We're not going to ban on those, from those foundational strategies that we know are effective. That the overall thing is to make sure that our schools are places where each student can thrive, right? And learn. That is the ultimate goal. The more we keep them in the school, the better they get that instruction day to day, and the better we will see academic performance improve as well. So that is our goal, is to continue on that journey. That's it.
Thank you. Thank you. Thank you. Ms. Middleton, Mr. Nay, do you have any questions?
No, ma'am.
No questions.
Nay?
Very informative. Thank you.
Mr. Dallas's hands up. Mr. Dallas, I was just waiting for Ms. Middleton and Mr. Nay, if they had any questions. Please go ahead.
No problem with that, ma'am. That's appropriate. They are full-fledged committee members, so no issues there whatsoever. I do have a couple of questions, and I'll just spew them out. Then if there's a response, that's fine. If not, I can follow up. Is there a communication mechanism to the public in terms of what is their perception of safety in our schools? Because I see sometimes incidents pop up in the news media, they're doing articles on them, and that negatively affects the perception. And so maybe a metric tracking how that perception is over time would help us ensure that we're reaching the key stakeholders and that they know that you're doing so many different things to improve and sustain safety. Along those lines, is there longitudinal data and also by school that would allow us to look back over a few years? I saw 2021 and 22, 23, but going back even further than that.
Yes.
Okay. And could it be in a graph form instead of numerical values so that visually could very quickly pick that up? Okay, thank you for that. And are parents informed of the negative impact that a 30-day suspension will have on the academic performance of their kids?
Why?
No, go ahead.
When you say a 30-day suspension, yes, yeah. Usually the longest we do for one offense is 10 days, but yes, we actually, by law, we have conferences with the parents. Typically, I would say the typical practice that we promote within our schools is when administrators sit down to do discipline and with the student, and then when they meet with the parent, the protocol that we've been working on is not to just discuss that disciplinary infraction. We typically sit and quickly review their grades, attendance, and that disciplinary infraction when we're doing. And so oftentimes you'll see that some of the interventions are different things when you meet with the child and you meet with the parent discussing that outcome, the disciplinary action. There's often other things to go with that suspension. There may be a referral to mental health counseling. There may be a referral to school counseling. There could be several different things that go along with that, but yet those conversations are had. And we have a system in place so that, we're tracking to make sure that those things occur. And we're looking at the time out of school when our students are out of school and tracking that across the system. I hope that answers your question.
Yes, sir, it does. And it may be worthwhile to have a public communication campaign that informs the public of the lengths which the school district goes to help sustain their kids in school, which is beneficial to the entire family. So you're doing so many great things, just trying to figure out how we get awareness deeper into the community. Thank you, everyone.
You have something?
Board members, I just wanted to mention as part of the disciplinary process that whenever a student is suspended, there's a conference that's held and the student has a right to a hearing. Sometimes they will bring counsel to a hearing. And part of those hearings, when I've been in attendance, something that these schools are doing now, which is helpful, is that the purpose of discipline, we want to correct the behavior and rehabilitate that student, but we will have a behavior intervention plan as part of your MTSS, referral to drug and alcohol to get them the treatment that they need if they have an issue with that. Like you said with the counseling, so it's a process to ensure that we help the child correct their behavior. And I just want to thank you all for all your hard work because you do a great job. So thanks. Thank you. Thank you.
I appreciate it. I appreciate the work that y'all are doing, but I think there's a lot more work that needs to be done. In terms of this, my question is looking at this matrix. What is the BMS? What is the BMS fall in the plan? I didn't hear that. What is that?
So we train the BMSs today, actually, we train them every month. And so the BMSs fall in on some of that teaching. So we're trying to transform, in the past few years, we've been transforming the BMS from being more of the, hey, this kid's acting up, go get him. We've been transforming them into more of one of the, like, almost like a behavioral teacher. So first off, they get into classrooms and they help with, say, Dr. White's acting up in class every day. Hey, can you come in and get some strategies? So BMS would go in and get some strategies. Reserve, get some strategies, and that's more of that tier 1 support, right? But then say that behavior keeps continuing. Now we're going to meet together as a team, and the BMS is going to kind of lead that conversation along with the school-based student services team, which could be your counselor, your nurse, because medication's a big thing. You want to get stabilized. Your social worker, that way we can collaborate with outside agencies. But that BMS is going to kind of bring that team together with the family and the student and form what we call a multi-tier system of support plan. So a behavioral plan. What we're going to do to teach you these skills, right? So now that BMS is starting to become more of a teacher. So that student would then have maybe 25 minutes a week where we go learn how to self-regulate or cope with different things that are going on in our life that are causing this behavior. Or sometimes that BMS might say, hey, and help read the data. Hey, this is happening only when the kids didn't ask to read. Have we looked at his academics? Right? And that BMS is kind of driving a lot of those conversations. And our BMSs, we're training them. They've received more training in the past 2 years, probably than I would be willing to say any other school district out there on how to be proactive, how to look at data, and how to come up with evidence-based solutions and curriculum or teaching, so they can teach kids what we expect and help with some of those skill deficits. Behaviors are skill deficit. If a kid doesn't know how to read, what do? We meet them where they are, we teach them how to read. If a kid doesn't know how to act, we're gonna have some discipline, of course, traditional sense of discipline, but we're also gonna meet them where they are and start teaching them replacement behaviors of how to act. That takes a while, it takes time. It doesn't happen overnight, right? But it's just like with reading or any other skill deficit. We're getting our behavior specialists and our behavior interventionists to be more proactive teachers, mentors, guides, if that makes sense.
Yeah, I hear that, but if that's the case, then I would question some of these OSS school suspension that I'm getting called on, and that some of them that I'm seeing, because the process that we're seeing is not what I'm seeing even visiting schools. And also we have some behavior intervention and BMSs. In that case, they shouldn't be out on hall duty, because if they're on hall duty and they're doing different things and teachers and principals are using them for the positions that they're not there for, then what you say, oh, that sounds good, but so that can't hold on, let me finish. That sounds good, but that can't be in play because that takes a lot of time, a lot of strategy, and a lot of intentional movement. And so if they're using BMSs to watch classrooms and do different things, and what you're saying, that's not taking place. So
and we'll look at it school by school, but what I will say, we do ask the BMSs be in a classroom, and especially at lunch, because that's when they make relationships with the kids and all that. So we ask them to do that. We also, since being here in 2 years, we've actually rewritten the BMS job description based on feedback from our BMSs and also other stakeholders. And we rewrote that job description for them, got it out last year to try to prevent some of the stuff that you're talking about. Or is it going to happen in some schools? Should it? No. Is it going to until we get everything tightened up? This be real, 30-some schools, right? It's going to happen. But one thing that we are doing is starting to get more feedback from all of our stakeholders. So then we can come into those schools and offer support to make sure that they are getting utilized for what they're used to.
Correct. I'm sorry. I'd like to add, if you've never met a BMS or BI. BMS is the Behavior Management Specialist, and the Behavior Interventionist in the schools. They're awesome.
Yes, sir.
I have worked with them. I have seen them in action because they build relationships. But I think the district has something in the clause that says other duties as assigned. So if at that moment, the BMS may not have a caseload at that moment, but they be needed to go to the cafeteria or to go and check out a student, that is within the guidelines of what they're hired for, along with working with our children and helping them build these relationships, because they would tell the BMS stuff that they won't tell us.
Yep.
And they get that help that they need. I think one of the best things that we could have done was bring in the BMSs and the BMIs. Now, the other thing is, our people can't be everywhere. We have a shortage of people, let's be honest. But when you have a team who's willing to put those things aside and do these best practices for discipline, which includes your BMS. If you look at this report, and this is all that it is, it's a report, it's a great report. But if you look at the numbers of the total office referrals for 21, 22, there were 21,000, right? 858. Now, we're saying that's 30% of our population of students. Do you know it would have been more than that if we had not had the BMSs in place? And the things that are in place, yes, I would love for those numbers to go down. You know, being a former administrator, I do know it's hard. But when you look at it, 6,566 students, it's the same students. It's the same student, we know that. You go into the schools, it's the same students. So this report is a really good report. I'm not here to bash the VMSs and the BMIs. VIs. I like the report. I like what you've done. This is a lot of data. But I also know it takes more than what we know. Working with our children every day, making them safe, having a safe place to be, people who they can go to. And these VMSs do that. You know, they provide a safe place for our students. If that means they're in the hallway, they're in the hallway. At that time, the principal has to decide where they need he or she the most, and they're accommodating. I'm appreciative of this report. I'm gonna sit down and look at it a little bit more, because you know this is my area with right choices. So I know what you're going through. Yes, I would love to get the numbers down.
Yes.
We all would.
That's what we're doing.
We all would. So I appreciate as Mr. Nay and Mr. Carlton said, this is some good information. And we need to be mindful of this was just a report.
Right, and at the same time, I do understand that I'm not discrediting BMS at all. But what I am saying is that the report is saying something different than what I'm actually seeing in the schools, and it's not going to be BMSs. I'm talking about as an administrator using BMSs, and if what you were talking about was taking place in some of the schools that I'm seeing, I'm actually seeing behavioral issues in. If the BMSs was doing some of those functions, then maybe we would have some less issues in terms of what's going on. But my issue is that what you're explaining here and what I'm seeing firsthand is not taking. It's really something. It's not taking place, and a lot of that is not on the BMS.
Tell me.
So,
Mr. Smith, where did you see this not happening?
We're talking about that.
No, I mean, you brought it up. So I'm just saying, this is not this venue, so we can talk later about this.
Right, but I want to be clear that. Right, and I did. That's what we clear. But the way you said it, it seemed as though I was talking about the BMSs, and I want to be clear. I'm not talking about the BMSs. I'm talking specifically about how this should, what should be taking place, that in terms of sometimes I don't believe the BMSs are being allowed to do their job and to do what actually you're saying that the function of their job is. Now, I want to make that, I do want to make that clear.
And Mr. Smith, if that's the case, I think maybe you and I can maybe speak or like talk, like, tomorrow or whenever, and that way I can bring it to my attention, I can go help intervene a little bit, if that's what you're saying. See, I mean, because we want this to be.
Let us know what school, or we can get to it. Okay, Mr. Campbell.
Exactly.
I don't care how many BMS you put in the schools. It starts with the parents.
Yeah.
That's when it started, and we don't address that.
Yeah.
Start with the parents. Yeah. So, I don't know how we're gonna change that. That's what.
Thank you. Are there any more questions or discussions? Thank you, and thank you so much.
Yeah.
We need a motion.
We need a motion
Need a motion to do
to
it.
accept this and to move it to either the consent agenda or, because it's the OE, so you all have to, you have to accept it. So I need a motion to accept it, move it on to the full board.
Okay,
And if you are in agreement, then it would go to consent agenda.
thank you, Ms. Christianberry. Can I get our consensus approval? For one of these members?
Madam Chair, I move that we move this, what OE is this, 13? The discipline,
13, yes.
okay, the discipline academic report to the full board or to the consent agenda. Would you like the full board to hear about this? Or is it,
It's up to you all, but it needs to move forward to the next board meeting. So wherever you would like for it to go, to the next board meeting.
yeah, move it to the next board meeting.
Thank you.
Second.
And on the second? Mr. Nick, second his name.
Are you asking for it as a presentation at the next board meeting as well, or do you want it on consent? Because if somebody wants it, they can move it off consent, but it's up to you.
If the information, I think it should be on consent, I mean, that's just my.
Let's move to the consent agenda.
So, I'll put it off.
All right, it has been moved in second that the OE 13 be moved to the consent agenda.
That would be the first meeting in November.
All approved, all in favor?
Aye.
Aye. Aye. It has been moved and second and approved to put the OE 13 on the consent board meeting in November. There's nothing else.
November 7th, correct?
Yes.
Thank you. So now we have.
Of student services, the guidance counselor. Counseling program presentation by Latasha Middleton, who is in her second year as the director of school counseling.
Evening, Madam Chair and board members. As Dr. White said, I'm in my second year as Director of School Counseling. I am in my 19th year in education and 15 years of being in youth. I am going to share with you all our goals for school counseling for this academic year. Our counseling goals are aligned with our district goals, which is to prepare graduates to compete and succeed in a global society. Our overarching goals for school counselors are providing quality professional development, increasing our college and career readiness percentage, and provide support for our new counselors to decrease attrition. The role of the school counselor is to design and deliver a school counseling program that promotes student outcomes. And that's through leadership and advocacy and equity and access for all students in areas of academic achievement, career, and social development. This aligns with our South Carolina profile of a graduate with world-class knowledge and world-class skills. And the competency statements are basically the soft skills that every student should have, whether or not they're graduating and going to college or going to the world of work. Strategies to support this goal are what we did last year was I had a needs assessment at the end of last year to determine what kind of professional development counselors would want to provide for them for this year. But due to changes in positions and new counselors, I'm deciding to do another assessment next week so that I can make sure that I'm providing great professional development for everybody. We have levels of counselors from 0 years of profession to 30 years in the profession. So I want to make sure that I'm providing them with the professional development to increase their ability as a school counselor at whatever level they're at right now. So as I said, professional development. I'm on the wrong slide, I'm sorry. So I want to maintain the current resources. I want to build capacity in the councils we have through collaboration among the councils in monthly Zoom meetings and in-person meetings. So right now, for my new counselors, we have a standing meeting every Friday to provide them support so they can ask questions. And I've also been meeting with them individually, and I'm meeting with all school teams individually to determine if their school goals are around their school goals around their counseling goals are the same. So I'm making sure that everything is aligned so that when they start to promote their school counseling program, everything is flowing smoothly. Professional development in terms of collaboration with our student services. So with our school counselors, school social workers, BMSs, school nurses, and admin, we work together to provide support to all of our schools and our school counselors. So we have done a lot of collaboration through suicide assessment training, transcript audits, and crisis support for our students.
And can I add to that professional development? So one of the things when we look at the student services model and while we're working with those is in our department, we collaborate and we problem solve, right? And so it is the model to schools. So Dr. Guys can speak to this one. For example, at Pritchardville Elementary, they use a student services model to help promote behavior wellness and all of that students. So we are doing this training together so they all can go back to their schools and we can start having that move into other schools. And if you want to speak a little bit about what that looks like at Pritchardville.
Yeah, it's kind of like the old matrix. That's one of the other changes in the matrix. It used to say like the kid did X, go see the BMS. They did Y, go see the counselor. They did Z, go see the social worker. And one thing that to really take care of the whole child, it's better to bring the whole team together because we all have different skill sets, right? We all have different connections. But for example, your social worker is connected with your outside agencies for that wraparound support. So instead of saying X equals this, Y equals that, we want to bring the whole student services team together to help really problem solve on what the root cause of some of the behaviors are. So hopefully we can start intervening on some of those. You know, of course, it's going to take time for that to change any behavior. It takes a lot of time, as we know, but that way you got a more holistic care team, basically.
To continue to support our school counselors, we want to pay attention to our student to school counselor ratio. So there are three different models. There's the ASCA model, the American School Counselor Association model, that recommends that you should be at 250 students to one counselor. There's the EEDA, the Education and Economic Development Act model, which recommends 300 students to one counselor. And then the South Carolina model that recommends 800 students to one counselor for K-5 and 300 to 1 for 6 to 12. In our district, if we divide it by levels, elementary is a ratio of 408 counselors to students to one counselor. K through 8, 262 to one counselor. Middle school, 226.4 to one counselor, and high school, 251. So this is an average. If you go to the next slide, I broke it down based on levels. So these are the elementary schools, and some schools are hitting the mark and some aren't, but we are closer to the EDA model for most of our schools, some of them are a little more higher. And we're gonna keep a close eye on that and try to work towards moving it closer.
Especially with our growth in some schools, so some of that is because of the increased student population at some
Yes.
schools, so
And we have had an influx of, in some schools, of students, which is a good thing, but we need to make sure that we're kind of balanced. And I do want to thank the board for the last couple of years. You all have been very strategic in helping us to get more CDS in school. We went from 2 CDS to 10 in Beaufort County and the one at ACE, so that we've done a good job. That I want to thank you all for that. So we have a CDF in every high school and 3 in 3 of our middle schools. So that has helped with our ratios as well. And we collaborate a lot with CTE in reference to promoting a lot of student successes and programs, and I've listed some of them out there for you. We've done career events, reality days, career interest inventories, lunch and learns, Be Pro, Be Proud, and full sale trucks, and college application day. And one big one that I know that you all have been promoting this year is the reality day. So all high schools are doing it this year.
Madam Chair, if I may add one item.
Absolutely.
And working with Ms. Middleton, she has been very collaborative. So although we are involved in another division, it's not like there's another division. From the language shared, from behavior, the relationship of student discipline to academics, to the work that Natasha does, there's always action happening between our divisions, and I think that's where it is a working tapestry.
Mr. Nay, Ms. Middleton, are there any questions for Ms. Middleton?
No, ma'am. Thank you, Ms. Middleton.
Mr. Nay,
No, no questions. Thank you.
thank you. Mr. Dallas.
I'm laughing. I may have worn out my welcome with all these questions, but we're getting close to the end.
Never.
For Ms. Middleton, I think it was on slide 14. It looked like the ratios might be slightly high.
For the K through 8.
Can you go? Okay, can you go? Maybe it was 15. Okay, no, there was one that had basically all the ratios there. It was what?
Elementary.
Yeah, this one. Yeah, this one. So to reach the state recommended 300 per counselor, how many more counselors would the district need to fund?
We would need to fund about 6 new counselors.
6?
Yes.
But this,
Okay.
But the state is 600 to 1 for elementary.
right,
EEDA is 300. I'm sorry, 800. Yeah, EEDA is so if we're looking at the state recommendation, we're aligned. But if we're looking at the other 2, we are a little off.
Yeah. So I would certainly hope that there is awareness throughout the board that this is a critically important area because it helps point kids to what could be their most rewarding avenues. And so if there's a desire to actually staff more counselors, that's one of the things I hear quite frequently in the community. And I had no information or awareness, that's my fault, on what the ratios were. So this has been very beneficial, and I thank you for sharing.
Anyone else?
Sure. First, I'd like to say thank you for this PowerPoint. Also, just in the future, could you also make sure that you put a date on this PowerPoint, and also a page number, so that we can know exactly which when it was. Also, well, you kind of just ask you in terms of one of my questions. Which one would you say that we use the most in terms of off of the AS and the CA off this page? Which one would you prefer to say that the district uses the most?
I would prefer the ASCA model. The ASCA model provides us a lot of guidance and documents to go by. So as far as, for example, every counselor has to provide annual calendar, weekly calendar, and their student goals, all of that, and those they're provided to us by ASA. So ASA gives us a pretty good framework on how to have an effective school counseling program.
So that's 250 to 1.
Yes,
Okay.
We can actually find that for people.
yeah.
For example, was in people each one.
And also, within this PowerPoint, what I said that you should that we are doing professional development, but what professional development are we doing in terms of our high school counselors and getting them, making sure that we're not having any kids fall through the cracks in terms of what they need to graduate and how we as from the district level, while we are from the district level, how are we monitoring to make sure that those conversations are happening?
We I bring in state accountability persons, Laura Merritt, several times per year, so they can hear it from her, because it's coming from the state. I do it right now, I'm doing audits behind the cameras, to make sure, because more 2 hours of everyone. Right now, we don't have a system that actually does this. We're looking to get one, but right now, we don't have one. So the counselors are auditing, and I'm auditing with the counselors. So I'm going through all the high schools, auditing and transferring behind them to ensure that they're not missing anything.
And also your translation transcript,
Yes,
which was significant.
yes. I also brought in,
Expert.
yes.
We brought in.
Diana Gronsky brought in, and so with the assistance of Dr. Travis, she paid for it. A very good person to help us transcribe international transcripts. We do have a large population of ML, so she came in and because that's very big. We got to make sure we're providing the appropriate translation for those students as well. So they got training on that. They'll get the state training on that again next month.
Anyone else, any more discussion?
It's very great.
They give it name. She's coming in.
We don't have to vote on it.
No.
Okay, Ms. Littleton, that's staying. Thank you so much. Thank you for being here. As always, Dr. Stiles. I don't know your name yet. Jillian? Did I ask you before? Ms. Jillian. Thank you all for coming and I thank you for the presentation from the time and I know we've been wanting this report from guidance for a long time. And there is information that our board members, as they go back out in the public, as Mr. Dallas said, he didn't know what to say. And that should never be. But thank you for presenting tonight.
Is this report going for the full board?
No.
It'll be in board docs, so the full board has the information under committee, but they won't be presented on it.
We have
Thank
future.
Yeah, at some point, there's guys for me, for the board.
We did, right?
Yeah.
We did. So the school counselors OE section of section 12 is actually OE 12.17. That was that section of that OE was completed in collaboration. That OE was presented last month and signed on the board yesterday.
And then we go in 14, which will be bringing next, there will be some things tied into that.
So there's services.
From the services that they do specific will be, and I think. when
That's
is that?
next month.
What's that date?
It's next month, right?
Right, so whatever they decide to set their meeting, yeah, we'll be doing that in a minute.
Oh,
Yeah,
okay.
we did that
Yes,
again.
ma'am.
Yes, ma'am. That's fine.
Your future topics,
Yes, any future topics?
OE 14 is one.
Yeah, I got that down here. OE 14, future topic. Ms. Middleton, Mr. Nay, any future topics?
I don't have one.
Janae?
None, thank you.
Okay. Mr. Campbell? Mr. Smith?
We would, no, that would follow this, no.
All right. I think Mr. Dallas is gone. All right, so.
Our next meeting,
Maybe look at November 28th if possible.
So technically, it should be the 22nd, but that is the day before Thanksgiving. So,
I will be doing then. No, just kidding.
by yourself, employees will not be working on that day.
And I can't do, I have book video on the 29th, and if there's another day that week. But generally, we are on a Wednesday, and I go apologize.
No, let's go, if you move it to the 21st, there's nothing on the 21st. We do have some,
Thanksgiving.
it is, so we do already have a committee meeting on the 20th at 3. So if you move it to the following week,
Can you do the 28th?
there's nothing on the 28th currently.
Miss Middleton, Mr. Nay, we're looking at the 28th of November. Is that okay?
Yeah, that's good for me.
Here on
That
the
work.
9th.
I can't miss the book, I do apologize.
Oh, no, it's right, all right.
So we said the 28th works for you all?
Yes,
It's a
Yes, ma'am.
Tuesday, so, okay, so
It's a
it's the
Tuesday.
Tuesday, the 28th at 5 o'clock?
yes.
Okay.
Thank you so much.
Thanks. So, and Madam Chair, and if I have updates regarding the 2 items from today, may those be on tentatively on the agenda.
Are you talking about the OD 14?
Now, so we'll have OD 14, have the update on health advisory,
Oh,
right,
yes.
personnel, and then as well as Mr. Day, continued follow-up from Mr. Copeland. I can get his information, so bridging the gap, I want to put into that language of what was identified for in library to library law.
Okay,
Yes, ma'am, because I left it as a to-do, it's still open.
all right. Okay. All right, can we move to adjourn?
So moved.
Thank
Thank
you
everybody.
all, thank you all.
Thank you,
you,
everybody. Very well done.
Take care.
Thank you, thank you.
Right.
Thank you. Thank you.
Yeah.